Zoonosis, as we all know, by the definition as WHO defined it as the diseases and infections which are naturally transmitted between vertebrate animals and humans. Okay, this is the definition of zoonosis as per WHO. Zoonosis, SES, actually that stands for plural. When you refers to more than one zoonotic disease, we call it as zoonosis. Actually, the term zoonosis was coined by Rudolf Virchow, so father of pathology. Actually, he also told that there should not be any dividing line between human and veterinary medicine. They're very much interrelated and complementary to each other. So he could recognize it in way back in 19th century itself. So regarding World Zoonosis Day, you are all aware. It's on 6th July 1885. The eminent Louis Pasteur. So he's the one who first inoculated rabies vaccine, so which is the vaccine ever discovered against zoonotic disease, which was inoculated to the boy called Joseph Mister on this day, 6th July. So to commemorate that day, so every year we celebrate World Zoonosis Day. So the major activity of World Zoonosis Day is to bring share knowledge on zoonotic diseases, their prevention and control. If you see the total zoonotic disease number, it's really astonishing. So we know that almost like 1,400 odd diseases there are infectious diseases of humans. Among them, nearly almost 61 to 62% are zoonotic. But most commonly, almost 200 diseases are very frequently seen, although it's said that 868. And again, what is more important is in the last 20 to 30 years, the total number of diseases which are emerging, out of them, almost 72% are of zoonotic and of wildlife origin. So wildlife is especially important because surveillance them itself is become difficult. If it is a domestic animals, it would have been easy. But since they are emerging from zoonotic diseases, continuous surveillance to detect their emergence would be difficult. Although these numbers are old, actually, if you see almost 2 decades old. So, but in the meanwhile, so almost in the last 2 decades, we have almost seen another 2-3. We have seen SARS in 2003, 2010-11 we saw MERS, again in 2019 from the same coronavirus family we have SARS-CoV-2. So, but the problem is it doesn't stop here. So we know that we already have several zoonotic diseases which emerge, and there are future many more may come. So, but the thing is, we don't know when the disease may emerge and where it may emerge. That's the biggest challenge. We are in the crossroad. So again, when we say the impact of zoonotic diseases, why we celebrate World Zoonosis Day at the global level, and why the health institutes or health organization at the global level like WHO, FAO, OIE giving so much importance is because of what you can see at the slides right now. So first of all, zoonotic diseases, definitely they cause morbidity and mortality in human and animals. That's the biggest impact that can cause on humankind and animals. But other than that, zoonotic diseases, they cause several economic impact, social impact, and psychological impacts as well. So if you see in the economic impact, the cost of healthcare, that means the cost which is spent on the treatment of humans, their prophylaxis when they are affected with zoonosis, and loss of livestock. You know it actually. Many of the zoonotic diseases cause mortality in animals. Sometimes production loss, like in case of loss of milk, abortions, infertility, that itself will add a lot of to the economic loss. And again, whenever there is a zoonotic disease outbreak, so suppose anthrax, so we may have to take vaccination to prevent its spread, to contain it to the place where it is. And again, sometimes culling, example, avian influenza. So whenever there is an outbreak, it is reported almost with is there in the culling zone, the birds have to be culled. Again, even after culling, we may have to go for surveillance for next around 30 days, right? In case of avian influenza. So all this will add to the cost of the total economic value. And again, because the human manpower required, the economic impact, the logistics required, the money which has to be spent on diagnosis of diseases, all of that will add to the economic loss because of zoonotic diseases. And again, whenever there is zoonotic disease emergencies there, even if it is a prevalent, so there is restriction on travel and tourism, because most of the times what happens, So definitely when there are zoonotic disease happens, definitely the health authorities will tell them the citizen not to visit those areas because those areas are at high risk. So, and again, whenever you have a zoonotic disease, definitely there will be a ban on the trade. For example, like avian influenza, whenever you have outbreaks, so for next till the outbreak or the infection is called as freedom, so the countries may not import the chicken. So that is again, and again, loss of consumer confidence. So this is especially in foodborne diseases. So whenever there is avian influenza or swine influenza, it's told definitely there is immediate reduction of consumption of the poultry. So this is again add to the economic loss. And again coming to social impact. See, as I told, so most of the livestock rearing in India, it's by marginal and small farmers. So if there is a death of an animal, maybe sheep and goat or a cattle due to anthrax or any other contagious zoonotic disease, so that will add to the poverty, because already people are in poverty line or the marginal economic category. So this itself will add to poverty. Because of that, there will be, since there is poverty, they may not be able to produce more economically, so which again results in food insecurity and unemployment. So again, so if there are certain diseases like COVID, which is again a zoonotic disease at first, but started transmitting from human to human. So since it's we know that it's transmitted through close contact or through the airborne, so people try to fear, actually they avoid coming in contact. So that's again it creates a social barrier. And again, stigma and discrimination. So we have all seen. So when COVID started, if somebody is having the initial part COVID, people are looking with a different angle, right? So that's one of the social stigma the people may suffer. And again, potential malnutrition. So as I said, there is huge mortality and morbidity from the zoonotic disease in animals. So that itself will lead to decreased production of milk, meat, egg. So that will create add to the malnutrition which is already existing in India. So and again, the next social impact will be burden on health services. So as we saw when the COVID started, so we had nowhere actually when it compared to regarding nursing of the people. So we didn't have enough isolation facilities, quarantine facilities, and even the laboratory capacity. It almost like a overwhelming for the any country for that matter, not only India. And again, psychological impacts. So first of all, the again lack of social security and mental agony suffered by the dependents. So whenever there is a people deceased, so you might have seen many people have died in outbreaks of Nipah, CCHF, which are of high consequences and high case of fatality rate. Definitely, the families of them will suffer because maybe they are the only people who may be the earning bread for the family. So and again, feeling of loneliness, betrayal. This can happen whenever there is isolation there. And again, in severe psychological stress, when people stay more and more indoor because of isolation or quarantine, there is possibility that there are reports when the people, the family related violences are more, maybe like marital breakdown, and even in extreme cases, people they may go into the sense like they may committing like suicide. So such is the extreme psychological the fears which can happen because of these zoonotic diseases. And again, why zoonoses are a global concern? Now it's not only India. Now zoonosis is a concern in the worldwide. Why? Because so they are unpredictable. So we don't know when the next zoonotic pathogen emerges, when and which place. So they are very much unpredictable. So again, whenever there is unpredictable and these kind of diseases are very new, so we will not be having any specific therapeutic and vaccines. So that's what happened in COVID as well, right? It took almost 1 year for the vaccine to be developed and again to be administered. But by the time already had a lot of casualties have been taken place. And again, there is high case fatality rate in case of emerging zoonotic pathogens because first of all, there is no therapeutic. Second, we may not know the patient management because the diseases are new. So again, one more important concern is their transboundary. So as I told, most of the diseases and people and products, they can travel in no time from one corner of the world to other corners. So immediately the disease can transmit from one part to other part. And again, so many of them may have epidemic and pandemic potential, like certain of the diseases like KFD and all are not of that pandemic potential if you see. So it's still limited to southern India. But as you see in COVID, SARS, MERS, many of them have had spread to many countries. So even if it's why, because now global community is more concerned, is because although it is detected in any one country, in no time it can spread to other. So everybody now concerned about zoonotic diseases, and everybody tries to fund or proactive in funding the research and development with respect to the surveillance and development of diagnostics and therapeutics with respect to zoonotic diseases. And again, if you see the burden, how zoonotic disease in terms of casualties, I already told you how social and psychologically it can cause. But if you see the human casualties, many of these diseases are called, starting from Spanish flu in 1919, 15 million deaths, till the highly fatal Ebola virus, almost like 1,500 deaths. And recently now, till today, actually, the figure with SARS-CoV-2 is almost like 63 lakh deaths globally. So that shows how zoonotic diseases are very important for the human health aspect. So, and again, a little bit on how these zoonotic disease emerge. What makes the zoonotic or pandemic diseases to come out? First of all, the over-exploitation of wildlife, maybe because of consumption or because of for the purpose of illegal trade. Again, urbanization, demand for animal protein. Because of the demand for animal protein, now more and more intensification of animals is taking place. That may be creating a lot of stress, which may help in emerging of certain zoonotic diseases. Again, climate change. So we know that actually, so untimely rain or untimely hot weathers are taking place. Just because you may be knowing, actually, if you are knowing the recent Japanese encephalitis outbreak in Australia. So Australia usually used to have only the travel-related JE cases, means those Australians who travel to the JE affected countries, when they come back only, they used to get the disease. But in the month of February, March, actually JE human cases as well as peak cases started in Australia. So one of the important the factor for that was climate change and untimely rain, actually, and flooding, which happened in the southern part of Australia. With that, what happened, the birds which are the reservoir of JE, they moved into the southern Australia. Because of that, the disease again started spreading in Australia, and that's how first major outbreak of Japanese encephalitis took place in Australia. So that's how climate change can contribute to the emergence and spread of zoonotic diseases. And again, food supply chain, which are very complex, starting from production, storage, and again then comes to the transportation until it reaches the hotel or the food consumer's plate. Again, travel and transport and agriculture intensification, all this will add to the emergence of zoonotic diseases and also for the further spread. Again, just a bit on priority zoonotic diseases in India. See, we know that there are several endemic zoonotic diseases which are there in India, but for the purpose of when you want to control and prevent certain diseases, you just have to first see which are all very important first, and then you can concentrate on others. With this background, and actually NCDC, they did an exercise to do the prioritization of the diseases which are existing. Okay, accordingly, these are the top 10 zoonotic diseases which have been prioritized for the prevention and control, or we can say more resource allocation. So accordingly, you have zoonotic influenza viruses, anthrax, Japanese encephalitis, leptospirosis, brucellosis, dengue, rabies, crab typhus, plague, and CCHF. So if you see from sheep and goat, we have diseases like anthrax, leptospirosis, brucellosis, and CCHF. Thank you very much.